Good evening, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us. Well, imagine having someone there with you every step of the way in your breast health care. Well, that's what we're going to be talking about tonight. I'm so happy to be joined by Dr. Camelia Lawrence. She is the Director of Breast Surgery at the Hartford Healthcare Cancer Institute at the Hospital of Central Connecticut and Midstate Medical Center. Thank you so much for joining us.
Thanks for having me, Tina.
Always great to have you here.
Likewise.
So I want to talk about something that many women may not know, but it's a key differentiator in terms of the care that's offered at the Hartford Healthcare Cancer Institute is a women's health coordinator as well as a nurse navigator, two very different roles, but they do work in synergy. So let's talk about that. Let's talk about first the women's health coordinator.
So at Hartford Healthcare, we exclusively offers access to a women's health coordinator. What that means is that every woman that walks through our door has access to this women's health coordinator. And her role is a very simple but important role, is that she helps to bridge the gap between the patient, the ordering physician, as well as the imaging center. So should an abnormality be identified, there's somebody there to provide guidance every step of the way. The woman is never alone.
But even prior to that, and I think that that's so important that many women out there may not be aware of a woman's health coordinator. You do hear a lot about nurse navigators,
Yes.
but let's talk about when that woman walks through the door, there's still navigation that needs to happen as well with her breast health care.
Yeah, absolutely. So the women's health coordinator helps to communicate any recommendation the radiologist may have. If it's an abnormality found on mammogram or ultrasound, she meets with the patient in real time. She communicates with the ordering physician in real time, who's then able to provide guidance regarding surgical consultation preferences as well as biopsy preferences. So what that approach allows for a woman to have sometimes same-day consultation and same-day biopsy. We're taking the weight out of the game and the anxiety that can be associated with waiting once you're told an abnormality is identified on your imaging.
And to just have that support system there is critical.
Absolutely.
And then now, let's say, okay, so a woman walks through the door, she has her mammogram, ultrasound if she needs it, she goes through her process, and let's say a biopsy is ordered, there is an abnormality found, and then ultimately there's a cancer diagnosis. What does the women's health coordinator do at that point?
So she makes sure the patient is plugged in appropriately. At that point, the patient is then introduced to her breast cancer nurse navigator, who remains with the patient along the care continuum. The management of the breast patient is very complex. It involves multiple subspecialties and experts. And the breast cancer navigator helps to bring all the pieces together for the patient, whether from seeing the breast surgeon to seeing the medical oncologist, as well as seeing the radiation oncologist. So she's there to sort of help the patient navigate through the entire process.
So there's really never any question of what do I do next?
No, not at all. There's always somebody there to provide that guidance.
And so what sort of was, I guess, the premise for developing this? To take it one step further and say, you know what, the nurse navigator is great when there's a biopsy or breast cancer detected, but let's rewind and start from the beginning. What was the premise for bringing a women's health coordinator on board?
Well, we were very interested in creating a very personalized, coordinated care experience for women who are utilized in our center. And the women's health coordinator, working in collaboration or in synergy with the referring physician as well as our breast cancer navigator, helps to facilitate that piece. The other added bonus was that it helps to mitigate loss to follow-up. Sometimes anxiety and fear, prevents a woman from proceeding with the care that they need. So having somebody along the way to support and encouraging them and to let them know that that biopsy is needed, it's warranted, and should the diagnosis of cancer be established, that you're not alone, is a very, very important role.
Yeah, I was going to say, were you finding that women were, they get up the courage to come in, but then they get a diagnosis, or maybe not a diagnosis, but maybe they get that call back that there is an abnormality found, and they get so scared that they just sort of disappear. Were you finding that?
Oh, absolutely, unequivocally. You would get those cases because, fear...
takes over.
Yeah, fear takes over. It's tempting. We do know that does not yield the best results. And that's why we're there, because we understand that every patient is unique, and we really want to coordinate the care. It's personalized care. And our team helps us, including the Women's Health Coordinator and the Breast Cancer Navigator, helps facilitate that.
What has been some of the reaction from patients, sort of, from day one coming in to have this person there with them?
It's been positive. I have had patients who come in and said, I had no idea this service existed, or they're just very thankful given the emotions that comes along when you're told that you have an abnormality in the breast, and having somebody there to really guide you along the way, and also to make sure that your care is being handled in a timely fashion.
Right.
Because of that real-time communication with the ordering physician regarding a radiologist's recommendation, at the Cancer Institute, we're seeing a lot of patients within the same day for consultation as well as biopsy where that's needed.
And I think that's another important factor to point out too. When a woman does come in and she has her screening mammography or ultrasounds or whatever it may be, that there is a radiologist there that is looking at those images,
Yes,
and you're getting that same day. There's no waiting.
There's no waiting in most cases, and there's a lot of real-time communication between myself as the breast surgeon and my colleagues with the radiologist. We're looking at the images together. We're having conversations with the patient in real time together. It's a unique setting and a service differentiator within the greater Hartford area.
I just think that taking the pressure off of something that can be so stressful and anxiety provoking is huge. And I would think would also, do you find that makes a difference in a woman's recovery because that anxiety is sort of tempered with a nurse navigator?
Yes, absolutely. Because there are a lot of myths surrounding what to expect.
Right.
And the Women's Health Coordinator can help to dispel some of those myths. And she also helps in terms of timely, compassionate care coordination so that you're getting answers very quickly as opposed to waiting a much longer period.
Well, and that you're also getting the right treatment, because if you're being told you have a diagnosis of a breast cancer, what do you even do?
Yeah.
What's the first step? So
There's so many moving parts when it comes to the management of the breast cancer patient, and having the breast cancer navigator as well as the women's health coordinator being involved makes a tremendous difference. We now know that surgery is no longer first line of treatment. There's some patients who benefit from going through neoadjuvant chemotherapy, then followed by surgery. And within Hartford Healthcare, we have all those pieces. At the Cancer Institute location in Plainville, all of the services are embedded within the same location. So there's ease of utilization, it's convenient, and all the expertise under one roof.
I was going to say the services as well as the expertise and the specialists like yourself as a breast surgeon. Dr. Camelia Lawrence, as always, it's such a pleasure to have you on. We thank you for everything that you do in the fight against breast cancer and being there every step of the way with women out there.
Thank you.
So we thank you. And of course, we thank you for watching. I'm Hartford Healthcare's Tina Verona. We'll see you soon.